We are discussing topic laxative and cathartic in this lecture. Laxatives are type of medicine that can treat constipation. For most people, constipation is best prevented by the natural way, including high fiber diet, adequate or plenty of water, regular exercise. Patient not responding to dietary changes or fiber supplements should undergo medical evaluation before initiating long-term laxative treatment. Laxative may be classified by their major mechanism of action, but many work through more than one mechanism. According to the classification, they are classified into 5 different classes: irritant and stimulant, bulk laxative, saline and osmotic laxatives, stool softener, and lubricant laxatives. Starting with the irritant and stimulant. Stimulant laxative cathartic induces bowel movements through a number of poorly understood mechanisms, and these including direct stimulation of enteric nervous system, and second mechanism is the colonic electrolyte and fluid secretion. Long-term use of cathartic associated with dependence and destruction of the meandric plexus results in colonic atony and dilation. Cathartic required for long-term use in bed-bound patients. There are 2 different classes or subclasses of irritant and stimulant. The first one is anthraquinone derivative, which are comprising of aloe, senna, and cascara sagrada, while the second subclassification of irritant and stimulant is diphenylmethane derivative, which is including bisacodyl medication. Now, starting with the anthraquinone derivative, these are poorly absorbed, produce a bowel movement in 6 to 12 hours when given orally, and within 2 hours when given rectally. Chronic use leads to a characteristic brown pigmentation of the colon known as melanosis coli may be carcinogenic. The second subclass, diphenylmethane derivative, they comes in tablet or oral form as well as in the rectal route of administration. So the tablet or oral form induces a bowel movement within 6 to 10 hours and 60 to 30 minutes when given rectally. It has minimal systemic absorption and appear to be safe for acute long-term use. Now come to the second class, bulk forming laxative. The common preparation include natural plant product, for example phycelium and methyl cellulose, while the synthetic is the polycarbophil. Their mechanism of action is that these are indigestible hydrophilic colloids that absorb water, forming a bulky emollient gel that distend the colon and promote peristalsis. The most common adverse effect associated with the bulk forming laxative is the bacterial dilation of the plant fiber within the colon, which may lead to increased bloating and flatulence. The third class is a stool surfactant agent or softener, and the drug which is included is the docusate, which comes in oral as well as in enemas. Its mechanism of action is these substances reduce the surface tension of the liquids. When ingested, the surfactant properties make it easier for water to be absorbed into the hard stool, and this process makes the stool softer and more loose so that it can be passed with less strain. Adverse drug reaction including aspiration in severe that can turn into a severe lipid pneumonitis. Long-term use can impair absorption of fat-soluble vitamin, that is A, D, and K. The fourth class is osmotic laxative. And these osmotic laxatives can be non-absorbable sugar or salt. For example, magnesium hydroxide that comes with the name of milk of magnesia, sorbitol, and lactulose. Lactulose is common preparation available as Dufalac brand name, magnesium citrate, sulfate solutions, and sodium phosphate. All these are non-absorbable sugar and salts. The colon can neither concentrate nor dilute fecal fluid. Fecal water is isotonic throughout the colon. Osmotic laxatives are soluble but non-absorbable compounds that results in increased stool liquidity due to an obligate increase in fecal fluid. High doses of osmotically active agent produce prompt bowel evacuation, or another term which is used for the evacuation is purgation, that is about within 1 to 3 hours. The rapid movement of water into the distal small bowel and colon leads to a high volume of liquid stool followed by bowel evacuation. The adverse effects associated with the non-absorbable sugar usually in renal insufficiency, hypermagnesemia due to magnesium hydroxide, flatulence due to lactulose during microbial metabolism. Sodium phosphate preparation should not be used in patients with renal insufficiency. These have significant cardiac diseases or are unable to maintain adequate hydration during bowel preparation. Although electrolyte imbalance is insignificant, the most common uses of laxative of non-absorbable sugar type laxative is to use in acute and chronic constipation and to cleanse the bowel prior to medical procedure or surgical procedures. The second subclass of osmotic laxative is the balanced polyethylene glycol, which is abbreviated as PEG. It is used for complete colonic cleansing before gastrointestinal endoscopic procedures. These balanced isotonic solutions contain an inert non-absorbable osmotically active sugar PEG with sodium sulfate, sodium chloride, sodium bicarbonate, and potassium chloride. These solutions are designed so that no significant intravascular fluid or electrolyte shift occur. For optimal bowel cleansing, about 1 to 2 liters of solution should be ingested rapidly over 1 to 2 hours on the evening before the procedure and again 4 to 6 hours before the procedure. For treatment or prevention of chronic constipation, a smaller dose of PEG powder may be mixed with water or juices and ingested daily. In contrast to sorbitol or lactulose, PEG does not produce significant cramp or flatulence. The last class is lubricant or softener. These lubricant and softener are more or less the same compound, a similar type of acting compound which are discussed in stool surfactant agent or softener. These agents soft the stool material, permitting more water as well as lipid to penetrate into the fecal material, which will allow them to evacuate more easily. Administered rectally, usually in terms of glycerin suppository for hospitalized patient. Mineral oils are also given, which are clear and viscous type of oil that lubricate fecal material and retarding water absorption from the stool. It is to be mixed with the juices. Long-term use can also impair absorption of fat-soluble vitamin because they are decreasing the absorption of fatty compound and fatty material, not permitting and not allowing to penetrate into the general circulation but into the stool. So that is the reason that stool softener as well as lubricant or lubricant type of softener can interfere or impair absorption of fatty compound, specifically the fat soluble vitamin. So this is all about laxative used to treat constipation. Thank you so much.